When I talk about my experience using two different kind of devices or treatment for the treatment of hyperhidrosis and osmidrosis too. This is my conflict of interest. If you right now put this phrase in your cell phones, the less hygienic celebrities, you're going to find these many image photos of our celebrity of sports, actor, actress, and musician, even people from the royalty who pass off this embarrassing moment by the sweat. Usually people associate the sweat with poor hygienic and lack of personal care, nothing far away from reality. This person have a lot of care about that. They change the clothes several times a day. They take showers several times a day to allow other people don't notice that. In addition, for these people who suffer about hyperhidrosis and osmidrosis, I give you the advice to look for another kind of people who have great high social and laboral exposure that they don't need. They have the possibility to show the armpit sweat. The definition of hyperhidrosis is excessive sweating that occurs spontaneously without being caused by high temperatures or by situation of physical or emotional stress and whose chronicity interferes with the usual work and social activity. All it means that is sweating without any stimulus. People like you and me at this moment start to sweat with drops. That means he suffers of hyperhidrosis. Is symmetric, beginning in childhood, in the preteens. This really common. 1 to 3% of all the people around the world suffer about that. In my country, is approximately 1.5 million of people will suffer about that, and majority of them didn't know that have a possibility to solve it. Appear more frequently here in Asia, especially in Japanese. Majority of the cases is family with this problem. Grandfather, father, son, all with this problem about sweating in the armpits, because majority of all the hyperhidrosis are from the armpits. And 90% of the armpit sweat came from the eccrina glands. Opposite to osmidrosis, osmidrosis is an increase in the odor in the armpit. It's caused because we have another sweat glands, apocrinas glands, to create a ceramide. This ceramide, when can reach to the surface of the skin, they reach to the normal flora bacteria and oxidate and create a great smell. In some cases, the normal flora that is staphylococcus change to anaerobic and corynebacterium, and this smell is more strong. Our patient create a special pattern of behavior to avoid any other people notice that, the odor and the sweat. That's why they avoid hug, they limit the movement, they walk like robots, they change clothes, as I mentioned, several times a day, they take showers several times a day, they use loose clothing to don't notice the sweat, the drawing sweat in the clothes, and they wear jacket, the sweater, even in the middle of the summer. There are different ways we can measure that. The more common is hyperhidrosis disease severity scale, HDSS. If you look for a lecture about that, a publish about that, you want to find that. But it's a subjective scale between 1 and 4, and only can measure the way that this illness impact in the normal activity of the patient. Another subjective test is the ghost test. Is the way we can evaluate the severity scale of the osmidrosis. It's more subjective because it's the physician pass a gauge in the armpit of the patient, smell, and put in a weight between 1 and 5. The only way to be objective is the minor test. We put iodopovidone on the armpit, then we put talcum powder, and we obtain this kind of drawing. And the way we sure we are successful is we reduce the drawing. Again, difference between hyperhidrosis caused by eccrina glands, opposite to the osmidrosis caused by the apocrinas glands. And this drawing is really important. Put focus on that because majority of eccrina glands are in the middle of the dermis, between 2.5, 3.5 millimeters of depth. Against the apocrinas glands is more deeper because need to reach to the shaft of the hair, and after that reach to the skin. That's why are more deeper, close to 40 4.0 millimeters. That's why you need at least a needle to go reach to 4, and better if you go reach to 5 to be sure you can be successful to both type of glands. We have two types of solution for that: surgical and non-surgical solution. Talking about surgical procedure, I want to talk about my experience in subdermal curettage and subdermal laser. Within this paper, I ask for you to read it. It's really important because after in this conclusion, they compare the effect between the laser to the curettage, and I ask of myself, why not apply both treatments simultaneously? This is the way I treat the osmidrósis, for example. I use the laser diódo 980. This is the device. This is the drawing of the RP on the patient. I start applying lidocaine 2% with epinephrine because it's painful treatment. After that, I apply the laser to increase the temperature below the skin, try to reach the apocrina glands in the deep part of the skin. And after that, I use this cannula with teeth to perform the curettage. When we talk about non-surgical procedure, I choose the intradermal radiofrequency. This is the device, or the tip of the device that I use. It's a bipolar radiofrequency. I can choose the depth between 0.5 to 5 millimeters. Usually, I choose 2.5 to 3 in female with hyperhidrosis, 3 to 2.5 in male with hyperhidrosis, and 4 to 5 in both of them when they have not only hyperhidrosis or osmidrósis at the same time. I can reach both type of glands I mentioned. I choose the time, I choose the intensity, but there is no selectivity. I cause thermocoagulation in several parts of the depth of the skin. I prefer the non-insulated type of needles because by the low impedance we have inside the dermis, our energy flows in this layer. That's why it's safe for the surface of the skin. It's safe for the deeper part of the skin. I only create this thermocoagulation inside the dermis. This is the video in which I show you in which way this needle send the energy to the surrounded of this tissue in the dermis, and I obtain this thermocoagulation. All this knowledge, all this expertise give me the possibility to write this article. EGPS is the third more important journal in plastic surgery. In this one, I found 50% of reduction of the sweating in 80% of my patients. Even that, I still have 4% of complications. That's why I'm still looking for a better device. Here is step by step. I apply the iodopovidone. I apply then the talcum powder. I take the excess of this talcum powder. I obtain by this way the drawing. You can see here the black area is where is more a quantity of sweat glands. After that, I draw in the area and start with the injection of lidocaine. And here is when I apply the device with microneedles. I have an endpoint. I'm really aggressive. I made stacking. I made overlapping, the stacking 3 times in the same dot. I need to be sure to obtain this kind of bruise to be sure I was successful. Here I am last year in Paris in the World Congress 2022, sent a workshop of this treatment. And these are my present parameters. It's helpful which one have my device. 2 others is only part of the data information. But important thing is you need to be aggressive to can reach majority of the sweat glands, to can kill majority of them to be sure your result is going to be forever. This is the way we can measure the result, in which one, same temperature, same position, same room, we obtain this kind of difference in the drawing after a few months. Another case showing the reduction of the drawing. It is another article. I give you the advice to read it, because they take a lot of papers with the keywords of microneedle and measure them in strong recommendation and low recommendation. And finally, the authors said that using the words of the authors, based on the above evidence, the author proposed a strong recommendation for radiofrequency microneedle to be used as a therapeutic intervention for axillary hyperhidrosis. Classical contraindication, any kind of device with radiofrequency, pacemaker, pregnancy, local infections, and keloid backgrounds. And talking about complication and side effects, since I use a different device, I haven't had any. My take-home message: 1 or 3% of all world population suffer about that. There are a lot of potential patients. Please don't lose it. There's always destruction of any kind of sweat gland in my hands, 20 to 30%. When I treat the patient, 2 sessions is one of my treatment every 15 days. And I obtain this kind of result. Without complete lesion of the epidermis, we obtain the restoration of the surface of the skin. That was, I don't have any kind of scars. When I have a complete osmidrósis without hiperhidrosis, I decide to use laser and curettage. But when I have hyperhidrosis or hyperhidrosis plus osmidrósis, my gold standard is microneedle radiofrequency. And this treatment is not only for hyperhidrosis or osmidrósis disease. As I mentioned, look for patients or people who have a lot of exposure, social or labor exposure, and these are potential patients too. Thank you so much for your attention.